While the principle of parsimony is a helpful guideline, it does not guarantee that the simplest explanation is always the right one. Sometimes, complex phenomena require complex explanations. Example, in weather patterns. While it might seem simpler to explain a storm as just occurring due to heat, the actual science of atmospheric pressure, moisture levels, and environmental factors can be quite complex, but is necessary for accurate weather prediction. 2. Scientific method. Occam's razor plays a role in the scientific method, where hypotheses are tested and evaluated. Researchers look for the simplest explanation that fits the data they collect before considering more complex alternatives. Example, in medical research, if patients respond positively to a drug, researchers initially consider the effects of the drug itself, rather than exploring complicated interactions with other medications unless necessary. 3. Decision-making. Parsimony can also aid in decision-making. When faced with various options, considering the simplest choice can reduce confusion and make the decision process easier. Example, if a school is deciding on how to improve student learning, the simplest decision might be to focus on improving teaching methods rather than launching an expensive new technology initiative that adds layers of complexity. Conclusion. Parsimony and Occam's razor emphasize the importance of simplicity in explanations and decision-making. By favoring simpler hypotheses that require fewer assumptions, we can better understand the world around us and make clearer decisions. This principle is especially useful in science and critical thinking and is an important concept to keep in mind as you prepare for your CPC exam. Confounded defective experiment. Sure, let's talk about confounded experiments and what it means for scientific research. Understanding this concept is important for evaluating the validity of experimental results. We'll break it down into key concepts, important details, and examples to make it clear. What is a confounded experiment? A confounded experiment occurs when the results of a study can be influenced by variables that the researcher did not control for, leading to confusion about what caused the observed effects. In simpler terms, it happens when an extraneous variable interferes with the experiment, making it hard to determine if the independent variable is truly responsible for the outcome. Key concepts. 1. Independent variable. The independent variable is the variable that the researcher changes or manipulates in an experiment to observe its effect on the dependent variable. Example, in a study evaluating how different amounts of study time affect test scores, the amount of study time is the independent variable. 2. Dependent variable. The dependent variable is what the researcher measures to see if it changes as a result of the manipulation of the independent variable. Example, in a study about study time, the test score is the dependent variable. 3. Extraneous variables. Extraneous variables are any factors outside the independent variable that could influence the dependent variable. If not controlled, these variables can confound the results of the experiment. Example, in the study on study time, extraneous variables could include factors like the student's prior knowledge, the difficulty of the test, or even the time of day when they study. How confounding occurs. Confounding occurs when two or more variables are mixed up, making it difficult to tell which one is causing the effect observed in the dependent variable. Example of confounding. Imagine a researcher conduct a study to see if a new diet helps people lose weight. If some participants also start exercising more while on the diet, it becomes unclear whether weight loss is due to the diet, the exercise, or both. Here, the exercise confounds the results. Important details. 1. Impact on validity. Confounding variables can threaten the internal validity of an experiment, meaning it can lead to incorrect conclusions about the relationship between the independent and dependent variables. Example, if researchers conclude that the new diet is effective based on weight loss, but exercise was not controlled for, the effectiveness of the diet is not demonstrated reliably. 2. Controlling for confounding variables. There are several ways to control confounding variables to ensure that the experiment measures what it intends to measure accurately. Random assignment. Randomly assigning participants to different groups helps balance out extraneous variables across groups, reducing their potential impact. Matching. Researchers can match participants based on certain characteristics to ensure comparability. Control groups. Including a control group that does not receive the treatment helps researchers compare outcomes and isolate the effect of the independent variable. Example of control. In the weight loss diet study, researchers could have a control group that follows a standard diet while the treatment group follows the new diet to see the true impact of the diet alone. 3. Defective experiments. Defective experiments refer to studies that have significant flaws, often due to confounding variables, leading to unreliable or invalid conclusions. Example: if a study on a new medication fails to account for participants taking other medications, the results can be defective because the influence of those other medications is not considered. Conclusion: confounded or defective experiments occur when extraneous variables interfere with the results, making it unclear what truly influences the dependent variable. Understanding how to identify and control for these variables is critical in designing valid experiments and drawing accurate conclusions. This knowledge will be beneficial for your preparation for the CPC exam and for evaluating research in the future. Basic versus applied research. Absolutely. Let's explore the distinction between basic research and applied research, as well as two specific types of applied research: action research and experience-near research. Understanding these concepts is important for recognizing how research is conducted and how it can be applied to real-world situations. What is basic research? Basic research is a type of scientific investigation that aims to increase our understanding of fundamental principles and theories. It is usually conducted to explore and expand knowledge, rather than to solve specific practical problems. The goal is to generate knowledge that can later be applied in various ways. Key points about basic research. 1. Focus on knowledge. Basic research primarily seeks to understand underlying principles and mechanisms without immediate practical applications in mind. Example: a scientist studying the effects of a specific gene on cell function is conducting basic research. They're not directly trying to solve a particular problem, but instead aim to build a foundation of knowledge about genetics. 2. Long-term goals. Basic research often provides essential information that serves as a basis for later applied research. Example: research examining how neurons communicate in the brain can lead to discoveries that help in understanding neurological disorders, even if that was not the primary focus of the initial studies. What is applied research? Applied research is conducted with the goal of solving specific, practical problems. This type of research takes knowledge gained from basic research and uses it to address real-world issues. The findings from applied research are typically intended to inform decisions, develop new technologies, or improve practices. Key points about applied research. 1. Practical applications. Applied research focuses on answering specific questions that lead to actionable outcomes. Example: a study analyzing the effectiveness of a new medication for treating depression is an example of applied research. The main goal is to find out whether the medication works in real patients. 2. Real-world impact. The aim of applied research is to produce results that can be applied directly to real-world situations. Example: research on methods to reduce student anxiety in schools typically looks for strategies that can be used immediately by educators or counselors. Types of applied research. 1. Action research. Definition: action research is a type of applied research where the researcher actively participates in the research process and seeks to solve a problem in a specific context. It often involves collaboration with stakeholders and aims for immediate improvements. Key features: action research is iterative, meaning it includes cycles of planning, acting, observing, and reflecting. It's often used in educational, community, or organizational settings. Example: a teacher implementing a new teaching strategy in their classroom to improve student engagement would conduct action research. The teacher would try the method, gather feedback from students, analyze the results, and then refine the approach based on what they learn. 2. Experience-near research. Definition: experience-near research focuses on understanding individuals' lived experiences and perspectives. This approach aims to gather insights from the people directly affected by a situation or problem being studied. Key features: researchers often use qualitative methods, such as interviews or observations, to capture the nuances of personal experiences and opinions. Example: Researchers studying how mental health services affect young adults might conduct interviews with those who have used the services to understand their personal experiences and needs. Summary of differences. Basic research seeks to expand knowledge, focuses on underlying principles without immediate application. Example, studying human genetics. Applied research aims to solve specific problems, focuses on practical applications. Example, examining the effectiveness of a new therapy for anxiety. Action research involves participants in the research process, aims for immediate improvements in a specific context. Example, teachers implementing and refining new teaching strategies. Experience near research focuses on understanding lived experiences, uses qualitative methods to gather insights directly from affected individuals. Example, interviews with patients about their mental health treatment experiences. Conclusion, understanding the differences between basic and applied research, as well as the specific types of applied research, such as action research and experience near research, is crucial for evaluating scientific studies and their relevance to real-world issues. This knowledge will help you critically analyze research findings and understand their implications, which is beneficial for your CPC exam and future career in the helping professions. Single subject design. Certainly, let's delve into the topic of single subject design, also known as N=1 research. This approach is often used in psychology and other fields to assess the effects of an intervention on an individual. We'll break it down into key concepts, important details, and examples to make it easy to understand. What is single subject design? Single subject design is a research method that focuses on individual cases rather than groups. In this design, a single participant is studied in detail to understand how a specific intervention or treatment affects their behavior or condition over time. Key concepts. N égale 1. N=1 refers to the number of subjects in the study. In this case, N stands for the number of participants, which in single subject design is just 1. The insights gained are highly detailed and specific to that individual. Example, if a researcher wants to evaluate how a new therapy helps a person with anxiety, they would focus solely on that one individual's experience and outcomes. 2. Repeated measures. Data is collected multiple times over different conditions. Researchers observe and measure the same participant's behavior or performance repeatedly, often before, during, and after an intervention. Example, in the anxiety therapy study, the researcher might measure the individual's anxiety levels weekly, both before starting therapy and during the therapy sessions, to see how their anxiety changes over time. 3. Baseline phase. A baseline phase is established where data is collected before any intervention is applied. This helps researchers understand the individual's behavior before the treatment begins. Example, before starting the therapy for anxiety, the researcher could record the individual's anxiety levels for several weeks to see the typical pattern and levels without the therapy. 4. Intervention phase. This is the phase where the intervention or treatment is applied. Researchers then continue to collect data to see how the person responds to the intervention compared to the baseline. Example, after establishing the baseline, the therapist begins weekly sessions with the individual. The researcher continues to measure anxiety levels to see if there's a noticeable reduction. Important details. 1. Visual analysis. Data from single subject designs are often displayed in graphs to visualize changes in behavior or performance over time. These graphs help illustrate whether the intervention produced a significant effect. Example, a graph might show the individual's anxiety levels over time, with one line representing the baseline phase and another representing the intervention phase. A noticeable drop in anxiety levels during the intervention indicates effectiveness. 2. Flexibility. One of the strengths of single subject design is its flexibility. Researchers can modify the intervention based on the individual's response, which allows for personalized approaches and treatment. Example, if the individual is not responding well to the anxiety therapy, the therapist might adjust the approach or techniques used, and researchers can continue to monitor the effects of these changes. 3. Limitations. While single-subject design can provide valuable insights, it may not always allow for generalization to a larger population due to the focus on just one individual. This means results might not apply to others with similar issues. Example: if a specific therapy works wonders for one person, it doesn't necessarily mean it will work the same way for everyone else with anxiety. Applications of single-subject design. 1. Clinical psychology. Single-subject design is frequently used in clinical settings to evaluate the effectiveness of therapies or interventions for individual patients. It helps tailor treatment strategies based on a person's unique needs. Example: a psychologist might use this design to measure how well a new cognitive behavioral therapy approach reduces symptoms in a single client. 2. Education. Educators may use single-subject design to identify effective teaching strategies for individual students with learning difficulties. Example: an instructor might implement a new reading technique with a single student and measure improvements in their reading comprehension over time. 3. Behavior modification. In behavior analysis, professionals often use single-subject designs to assess interventions designed to change specific behaviors, such as reducing disruptive behavior in children. Example: a behavior analyst might work with a child with ADHD and implement a reward system to encourage positive classroom behavior, tracking changes over time. Conclusion: single-subject design is a valuable research method focusing on individual cases to assess the effects of interventions on behavior or conditions. This design allows for in-depth understanding and tailoring of treatments, although its findings may be less generalizable to larger populations. Learning about this method is important for your preparation for the CPC exam and useful for evaluating research in various fields. Baseline measurement. Sure, let's explore the concept of baseline measurement, which is an important aspect of research, especially in fields like psychology and medicine. We'll break it down into key concepts, important details, and examples to make it easy to understand. What is baseline measurement? Baseline measurement refers to the initial data collected about a subject's behavior, condition, or performance before any intervention or treatment is applied. This measurement serves as a point of reference that allows researchers and practitioners to assess the effects of an intervention later on. It essentially helps to establish what normal looks like for the individual before any changes occur. Key concepts. 1. Purpose of baseline measurement. The main purpose of baseline measurement is to provide a clear understanding of the subject's initial state. It helps in determining whether any changes observed later can be attributed to the treatment or intervention being assessed. Example: if a researcher wants to evaluate the effectiveness of a new diet plan on weight loss, they first measure the participant's weight before starting the diet. This initial weight serves as the baseline for comparison. 2. Types of measurements. Baseline measurements can include various types of data, depending on what is being studied. This could be quantitative data or qualitative data. Example: in studying anxiety reduction through therapy, baseline measurements might include the participant's self-reported anxiety levels before therapy starts, along with observations from a therapist. 3. Duration of baseline measurement. Baseline measurements may be taken over a set period to capture variations and ensure that the data reflects a consistent pattern before any intervention. This helps account for normal fluctuations in the behavior being measured. Example: if a researcher is examining a child's classroom behavior, they might observe and record the child's behavior daily for 2 weeks before beginning any behavioral interventions. Important details. 1. Comparison point. Baseline measurements act as a comparison point when evaluating the effectiveness of an intervention. After the intervention, researchers measure the same behavior or condition again to see if any changes occurred. Example: in the weight loss study mentioned earlier, participants would be weighed again after following the diet plan for a specified period. Comparing their new weight to the baseline weight helps determine the diet's effectiveness. 2. Establishing credibility. Establishing a reliable baseline measurement enhances the credibility of the study or intervention by demonstrating clear evidence of progress or change. This is crucial for making informed decisions based on the results. Example: A therapist measuring a client's depression levels before treatment with a standardized assessment can later use those results to compare how much the client's symptoms have improved. 3. Variability and stability. It's essential to assess how stable the baseline measurements are to ensure they accurately reflect the participant's usual behavior or condition. If there's a lot of variability in the baseline data, this may complicate understanding the effects of the intervention. Example: if a participant's anxiety levels fluctuate widely during the baseline phase, the researcher may need to extend the baseline measurement period until a stable average can be established. Applications of baseline measurement. 1. Clinical settings. In clinical practice, baseline measurements are critical for evaluating the effectiveness of treatments, therapies, or interventions for patients. Example: a doctor might record a patient's blood pressure before prescribing medication to manage hypertension, allowing them to compare it after the medication has been administered. 2. Educational settings. Educators may use baseline measurements to assess students' academic performance before implementing new teaching strategies. This helps determine if the new methods improve learning outcomes. Example: a teacher could assess students' math skills with a pretest before introducing a new curriculum. The same test could later be retaken to evaluate improvements. 3. Behavioral research. Researchers studying behavioral interventions, such as improving social skills in children, will establish baseline behaviors to measure the success of their interventions. Example: a researcher might observe a child's interaction with peers over a week before starting a new social skills program, allowing for comparison with post-program interactions. Conclusion: baseline measurement is a crucial step in research and practice that provides a reference point for evaluating the effects of any intervention or treatment. By understanding the current status of a behavior or condition before changes are made, researchers and practitioners can draw meaningful conclusions and make informed decisions. This knowledge will be critical as you prepare for your CPC exam and evaluate research in your future career in the helping professions. ABAB withdrawal reversal designs. Certainly, let's explore AB, ABA, and ABAB withdrawal reversal designs. These are types of single-subject research designs used in psychology and other fields to evaluate the effectiveness of interventions. We will break down each design and clarify key concepts, important details, and examples to make everything easy to understand. What are withdrawal reversal designs? Withdrawal reversal designs are research methods used to observe the effects of an intervention by alternating between phases of applying the intervention and phases of removing it. This allows researchers to see how the subject's behavior changes when the intervention is introduced and taken away. These designs help establish whether the behavior change is truly due to the intervention. Key concepts. 1. Phases of a design. The designs typically consist of at least 2 phases, a baseline phase and an intervention phase. In withdrawal designs, the intervention phase is followed by a return to the baseline condition to see how behavior responds when the treatment is removed. 2. Behavior changes. The primary goal is to observe changes in behavior during the different phases. This will help determine if the intervention is effective. Types of designs. Up design. Description: the AB design consists of 2 phases. A. This is when the researcher measures the behavior of interest without any intervention to understand its initial state. B. This is when the intervention is introduced and the researcher measures the behavior again to see if there are any changes. Example: suppose a teacher wants to see if a new reading program helps improve students' reading levels. The teacher measures students' reading scores for a few weeks. Then they introduce the reading program and measure the students' scores again. If scores improve during the intervention, it suggests the program is effective. 2. ABA design. Description: the ABA design includes 3 phases. A. The researcher measures the behavior without intervention. B. The researcher applies the intervention. A. The researcher removes the intervention and returns to the baseline conditions to see if the behavior goes back to its initial state. Example: using the same reading program scenario, after introducing the program and measuring improvement, the teacher stops the program and continues measuring the students' reading levels. If the reading scores drop back to where they started before the program, it indicates that the program was effective in improving reading scores. 3. ABAB design. Description. The ABAB design consists of 4 phases. A. Initial measurement of behavior. B. Intervention is applied. A. The intervention is removed and behavior is measured again. B. The intervention is put back in place and behavior is measured once more. Example. Continuing with the reading program, the teacher first measures reading levels, then applies the program and measures improvements. After that, the teacher removes the program and measures scores again. Lastly, the teacher reinstates the reading program and measures scores once more. If the scores improve with the intervention and decline when it is removed and improve again when reinstated, this design strongly indicates the effectiveness of the program. Important details. 1. Visualizing results. Researchers often use graphs to visualize the data collected during each phase. This helps clearly show the effects of the intervention. Example, a line graph might show reading scores over time, with dips representing baseline phases and peaks showing scores during intervention phases. 2. Internal validity. Withdrawal reversal designs provide strong evidence for the effectiveness of an intervention because they show how behavior changes when the intervention is applied and withdrawn. They help control for other factors that may influence the results since the same individual serves as their own control. 3. Limitations. While these designs offer many advantages, they also have limitations. For example, if behavior doesn't revert to baseline after withdrawing the intervention, it can complicate the interpretation of results. Additionally, some interventions may not be easy to withdraw or may have ethical implications in certain situations. Conclusion. AB, ABA, and ABAB withdrawal reversal designs are systematic ways to study the effects of interventions on individual behavior. By alternating between baseline and intervention phases, researchers can observe how changes in treatment influence outcomes. Understanding these designs is essential for evaluating research and interventions in psychology and education, and it will be valuable for your preparation for the CPC exam. Multiple baseline design. Sure, let's take a look at multiple baseline design, a type of research method used in single-subject studies, particularly in psychology and education. This design helps assess the effectiveness of an intervention without the need to withdraw it like in ABAB designs. We'll break down the key concepts, important details, and provide examples to make it easy to understand. What is multiple baseline design? Multiple baseline design is a research method that involves measuring the effect of an intervention across multiple settings, behaviors, or individuals. Instead of comparing a single individual's behavior before and after intervention, this design establishes baselines for different subjects or behaviors and introduces the intervention at different times for each. This helps researchers determine if the changes in behavior can be attributed to the intervention itself. Key concepts. 1. Baseline phase. In multiple baseline design, a baseline phase is established for each subject, behavior, or setting. A baseline is where researchers measure the behavior of interest without any intervention to determine its initial state. Example, if you're studying the effectiveness of a new reading strategy, you could measure the reading abilities of 3 different students over a few weeks to establish their baseline reading levels. 2. Stageur d'intervention. After establishing the baseline for multiple subjects or behaviors, the intervention is introduced to one subject or behavior at a time, while the others continue to be measured in the baseline phase. This is known as staggered intervention. Example, using the reading strategy, you might first introduce it to one student after observing their baseline for a few weeks. After a set period, you could then introduce the same strategy to the second student while continuing to monitor both the first student and the third student. 3. Comparison across participants or behaviors. The multiple baseline design allows researchers to observe how the intervention affects each subject or behavior at different points in time and compare the results. Example, after 2 weeks of using the reading strategy with the first student, you might see significant improvement in their reading level. After introducing the strategy to the second student, You can compare their progress to the first student's progress to determine if the strategy works similarly across different individuals. Important details. 1. No withdrawal required. One of the key benefits of multiple baseline design is that there is no need to withdraw the intervention for a particular subject to see if their behavior returns to baseline levels. Because the intervention is implemented at different times, it helps avoid potential ethical issues associated with removing helpful interventions. Example: in a therapy context, if a psychologist uses a new technique with each client, they can assess the effectiveness without stopping treatment for anyone. 2. Visual representation. Data collected from multiple baseline designs are often represented visually in graphs, showing baseline measurements and behavior changes after the intervention. This helps illustrate the effects clearly. Example: a line graph could show each student's reading scores over time, with distinct points indicating when the reading strategy was introduced for each student. 3. Controlling for other variables. This design helps control for variables that might affect the outcomes, as it allows researchers to see if improvements occur only after the intervention is introduced. If one student improves after starting the reading strategy, while the others do not during their baselines, it suggests that the intervention likely caused the improvement. Example: if student A starts using the strategy and shows improvement, but student B and student C do not show any changes in their scores, it strengthens the case that the reading strategy is effective. 4. Limitations. While multiple baseline design has many strengths, it has some limitations too. For instance, if the behavior of interest changes over time for reasons unrelated to the intervention, it can complicate the interpretation of results. Example: if a student improves their reading level during the baseline phase due to changes in motivation or support at home, this could affect the data and lead to incorrect conclusions about the effectiveness of the reading strategy. Conclusion: multiple baseline design is a valuable research method that enables practitioners to assess the effectiveness of interventions across multiple subjects or behaviors without needing to withdraw treatment. By measuring behavior before and after introducing interventions at staggered times, researchers can determine whether changes are genuinely due to the intervention. Understanding this design is essential for evaluating psychological and educational research, and it will help you as you prepare for your CPC exam. Sure, let's explore the concepts of simple blind and double-blind studies. These are important research designs used in experiments, especially in fields like psychology and medicine. We'll break down the key concepts, important details, and provide examples to help you understand them easily. What is a blind study? A blind study is a type of research design where participants do not know certain details about the study to reduce bias. Bias can occur when participants' expectations influence the outcomes of the study. By keeping details hidden, researchers can obtain more accurate and reliable results. Key concepts. 1. Bias. Bias refers to any influence that can affect the study's results in a way that is not related to the actual intervention being tested. This can happen if participants have expectations or beliefs that influence their responses or behavior. Example: if participants know they are receiving a new medication, they might feel better simply because they expect it to work, rather than because the medication itself is effective. Simple blind study. Description: in a simple blind study, only the participants are unaware of certain aspects of the study. Specifically, they do not know whether they are receiving the treatment being tested or a placebo. However, the researchers know which participants are receiving which treatment. Purpose: this design seeks to minimize participant bias, as their knowledge of whether they are receiving the treatment could influence how they respond or report their experiences. Example: imagine a study testing a new pain relief medication. Participants are divided into two groups. One group receives the actual medication, while the other group gets a placebo. The participants do not know which group they belong to, but the researchers do. This helps ensure that any reported effects are due to the medication itself and not influenced by the participants' expectations. Double-blind study. Description: in a double-blind study, both the participants and the researchers are unaware of who is receiving the treatment and who is receiving the placebo. This design further reduces bias from both sides. Both the participants' expectations and the researchers' potential biases influence the results. Purpose: by keeping both groups in the dark about who is receiving what. The study aims to provide even more reliable outcomes, as it eliminates bias that could arise from the researchers' interactions with participants or their expectations when analyzing the results. Example: using the same pain relief medication example. In a double-blind study, neither the participants nor the researchers know who is receiving the medication and who is receiving the placebo. So, when participants report their pain levels, the researchers cannot unintentionally influence their responses, and the analysis remains unbiased. Important details. 1. Reducing confounding variables. Both simple blind and double-blind designs help reduce confounding variables, factors that can affect the study results, by minimizing bias. This ensures that any observed effects can be more confidently attributed to the treatment itself, rather than external influences. 2. Enhancing credibility. Studies that use blind or double-blind designs are often viewed as more credible and robust because they take steps to eliminate bias. This makes their findings more trustworthy and reliable. 3. Applications and research. Blind and double-blind studies are commonly used in clinical trials for medications, psychological research, and behavior studies to ensure that the outcomes are evaluated fairly. These designs are preferred in scientific research because they help uphold ethical standards and integrity in the study results. Conclusion: simple blind and double-blind studies are important research methods used to minimize bias and ensure that the results of an experiment reflect the effects of the treatment itself. In a simple blind study, only the participants are unaware of which group they belong to, while in a double-blind study, both participants and researchers are kept in the dark. Understanding these concepts will help you critically assess research and studies, which is crucial for your preparation for the CPC exam. Simple blind. The subject does not know their condition. Absolutely. Let's discuss the concept of a simple blind study, specifically focusing on how it works when the subject does not know their condition. This is an important research method used to reduce bias and improve the validity of an experiment. We'll break down key concepts, important details, and provide examples to help you understand. What is a simple blind study? A simple blind study is a research design where the participants do not know which treatment or intervention they are receiving. However, the researchers conducting the study do know what treatment each participant is receiving. This design is used to minimize participants' expectations or biases that could affect the study's results. Key concepts. 1. Blind design. In a blind design, the focus is on keeping the participants unaware of certain details about the study, such as whether they are receiving the actual treatment, a different treatment, or placebo. The aim is to prevent their knowledge from influencing how they respond or behave during the study. 2. Conditions. An important part of a simple blind study is the condition the participant is assigned to. This could include experimental group, the group receiving the actual treatment or intervention. Control group, the group receiving a placebo or no treatment at all. This group helps researchers compare the outcomes and see if the treatment has a real effect. How simple blind studies work. 1. Establishing groups. In a simple blind study, participants are randomly assigned to either the experimental or control group. The random assignment helps ensure that the groups are similar in all respects at the start of the study. 2. Conducting the study. Researchers then administer the treatment to the experimental group while the control group receives the placebo. During this time, the participants do not know which group they are in. 3. Measuring outcomes. After the treatment period, researchers measure the outcomes of interest in both groups. Because the participants in the experimental group are not aware that they are receiving an actual treatment, their responses can provide unbiased data. Important details. 1. Reducing participant bias. One of the significant advantages of a simple blind study is that it reduces bias from the participants. If they know they are receiving a treatment, they might expect to feel better or show improvements just because of that expectation, which could distort the results. Example: If a person knows they're taking a new pain medication, they might report feeling less pain simply because they expect the medication to work. 2. Continuing researcher knowledge. While participants do not know which treatment they are receiving, researchers do. This allows them to administer treatments properly and monitor the outcomes, while still maintaining objectivity when analyzing the results. 3. Limitations. A simple blind study can still have limitations. For instance, researchers may unintentionally provide clues to participants about which group they are in through body language or comments. This could still affect how participants behave or respond. Example of a simple blind study. Imagine a study is being conducted to test the effectiveness of a new stress relief app. Here's how a simple blind study might work. 1. Participants. 100 volunteers interested in reducing their stress levels. 2. Random assignment. The participants are randomly assigned to 2 groups. Group A receives access to the new stress relief app. Group B receives access to a standard app that provides no stress relief techniques, but they do not know that it's not meant to help their stress. 3. Conducting the study. Both groups use their assigned app for 4 weeks. Group A uses the new app, while Group B uses the standard app. 4. Measuring results. At the end of the study, participants complete a stress assessment. Because Group B thought they were using an effective app, their responses are not influenced by knowing they were actually in the control group. Conclusion. A simple blind study is an effective way to minimize bias in research by keeping participants unaware of which treatment they are receiving. This helps ensure that the results accurately reflect the treatment's effects rather than participants' expectations. Understanding this type of study is essential for evaluating research outcomes and will be valuable as you prepare for your CPC exam. Double-blind. Neither the subject nor the experimenter knows the condition. Sure, let's dive into the concept of a double-blind study. This is an important research method used in experiments, especially in the fields of psychology and medicine. We'll break down the key concepts, important details, and provide examples to help you understand it clearly. What is a double-blind study? A double-blind study is a research design where neither the participants nor the researchers know which treatment the subjects are receiving. This method helps eliminate bias and uncertainty from both sides, ensuring that the study's results are as accurate and reliable as possible. Key concepts. 1. Bias. Bias refers to any influence that can distort the results of a study. If either the participant or researcher has expectations or knowledge about the treatments, it can affect their behavior or interpretation of the results. A double-blind study minimizes this risk. Example. If a researcher knows that a participant is receiving a new medication, they may unintentionally influence how they interact with that participant, which could affect the participant's responses. 2. Conditions. Just like in simple blind studies, participants in a double-blind study are assigned to different conditions. Experimental group. The group receiving the actual treatment or intervention. Control group. The group receiving a placebo or no treatment at all. This allows researchers to compare the effects of the actual treatment with those who do not receive it. How double-blind studies work. 1. Random assignment. Participants are randomly assigned to either the experimental or control group. Random assignment helps ensure that both groups are similar at the start of the study. 2. Blinding. In a double-blind study, the identity of the treatment each participant receives is kept secret from both the participants and the researchers. This means that participants do not know if they are receiving the actual treatment or a placebo. Researchers do not know which participants are receiving which treatment when they collect data or interact with the participants. 3. Data collection. Researchers conduct the study without knowing which participants are in which group. This helps them remain objective when measuring outcomes and analyzing data. Important details. 1. Eliminating bias. The key benefit of a double-blind design is that it reduces bias from both the participants and the researchers. This increases the validity of the study, meaning the findings are more likely to reflect the true effects of the treatment being studied. Example. If participants do not know whether they're taking a medication or a placebo, their responses about how they feel will be based on their actual experience rather than what they expect to happen. 2. Enhancing credibility. Because double-blind studies minimize the risk of bias, their results are generally regarded as more trustworthy and credible in the scientific community. 3. Applications and research. Double-blind studies are commonly used in clinical trials for new medications, psychological treatments, and other interventions to ensure that the outcomes are measured fairly. These studies are considered a gold standard in research design because they help ensure data integrity. Example of a double-blind study. Imagine a study being conducted to test a new medication for treating anxiety. Here's how a double-blind study might work. 1. Participants. 200 volunteers with anxiety who are interested in trying a new medication. Random assignment. The participants are randomly assigned to 2 groups. Group A receives the actual anxiety medication. Group B receives a placebo, but they do not know that it is just a sugar pill. 3. Conducting the study. Neither the participants nor the healthcare providers administering the treatment know which individuals are in Group A or Group B. This is maintained throughout the study. 4. Measuring results. After a specified period, participants report their anxiety levels. Because neither the subjects nor the providers know which treatment was given, the researchers can objectively assess the data to see if the medication was effective compared to the placebo. Conclusion. A double-blind study is a powerful research method that helps eliminate bias by ensuring that neither the participants nor the researchers know who is receiving the treatment or the placebo. This results in more accurate and reliable outcomes, making it easier to evaluate the effectiveness of an intervention. Understanding double-blind studies is crucial for critically assessing research findings, which is especially important as you prepare for your CPC exam. Demand effects. Certainly, let's explore demand effects, an important concept in research that can influence the outcomes of study. Understanding this topic is essential for evaluating how research is conducted and how results can be interpreted. We'll break it down into key concepts, important details, and examples to make it easy to understand. Or demand effects. Demand effects occur when participants in a study change their behavior or responses based on what they believe the researchers expect or want to find. This can happen when participants try to fulfill perceived expectations, which can distort the study's results. Key concepts. 1. Participant expectations. Participants may have ideas about what they think the study is about or what the researchers are trying to prove. These expectations can lead them to act in ways that align with what they believe is desired or acceptable. Example. If participants know they are in a study about a new teaching method, they might behave more positively or engage more than they typically would, thinking that's what the researchers want to see. 2. Social desirability. Participants might provide responses they think are more acceptable or favorable, rather than being completely honest. This is often referred to as the social desirability bias. Example. In a study about eating habits, participants may underreport how much junk food they eat because they believe unhealthy eating is viewed negatively by society. How demand effects occur. 1. Participants' beliefs. Participants may form beliefs about the purpose of the study based on the information they receive or their interactions with the researchers. These beliefs can lead to unintentional bias in their responses. Example. If a study is advertised as testing a new depression treatment, participants might be more likely to report feeling better, even if their actual experiences haven't changed. The way researchers phrase their instructions or the environment in which the study occurs can give cues to participants about how they should respond. Example. If a researcher asks participants how much they enjoy a new product and uses excited language, participants might feel encouraged to provide overly positive feedback. Important details. 1. Avoiding demand effects. To reduce demand effects, researchers can use various strategies. Deception. Sometimes, researchers may use deception to make sure that participants do not know the true purpose of the study. However, this approach must be justified and is subject to ethical guidelines. Neutral instructions. Providing neutral instructions that don't hint at what the researchers expect can help mitigate demand effects. Anonymous surveys. Using anonymous surveys can encourage participants to respond honestly, as they may feel less pressure to conform to perceived expectations. 2. Measurement bias. Demand effects can lead to measurement bias, where the data collected does not accurately represent the true behavior or attitudes of the participants. This can complicate the interpretation of research findings and make it difficult to draw reliable conclusions. 3. Implications for research. Demand effects highlight the importance of careful study design. Researchers need to be aware of how participant expectations can influence results and take steps to minimize these effects. Understanding demand effects is crucial for critically evaluating research studies and their findings, particularly in psychology and social sciences. Example of demand effects. Imagine a researcher conducting a study on job satisfaction in a workplace. 1. Research goal. The study aims to see how satisfied employees are with new work-from-home policies. 2. Setup. Employees know they are being surveyed about their job satisfaction. They might feel pressure to respond positively to show that they appreciate the company's policies. 3. Outcomes. If many employees report high satisfaction solely because they think the researchers want that result, the data will be skewed and not accurately reflect reality. 4. Analysis. The researcher might incorrectly conclude that employees are very satisfied with the new policies, while the reality might be different. If demand effects weren't properly controlled, the study's findings would lack validity. Conclusion. Demand effects occur when participants adjust their behavior or responses based on their perceptions of what researchers expect. This can lead to biased outcomes and limit the validity of research findings. Researchers must be mindful of demand effects when designing studies and interpreting data. Understanding this concept will help you critically assess research results, which is important as you prepare for your CPC exam. Experimenter effects. Sure, let's explore experimenter effects, an important concept in research that can influence the outcomes of a study. Understanding this topic is vital for evaluating how research is conducted and how reliable the results are. We'll break it down into key concepts, important details, and examples to clarify everything. What are experimenter effects? Experimenter effects refer to the unintended influences that researchers have on the participants in study. These effects can arise from the way researchers interact with participants, their expectations about the study, or even their nonverbal cues. When experimenter effects occur, it can lead to biased results and inaccurate conclusions. Key concepts. 1. Bias from interaction. Researchers may inadvertently communicate their expectations to participants through their behavior or reactions during the study. This can influence how participants respond or behave. Example. If a researcher looks pleased or excited when a participant gives a particular answer, the participant might feel encouraged to respond similarly in the future, thinking that they are providing the right answer. 2. Rosenthal effect. Named after psychologist Robert Rosenthal, this effect describes how the expectations of researchers can affect the performance of participants. When researchers expect certain outcomes, their behavior may unintentionally lead participants to respond in ways that meet those expectations. Example. In a classroom study, if a teacher believes that some students will do exceptionally well, they might provide them with more encouragement and support, leading those students to perform better due to the additional attention. How experimenter effects occur. 1. Expectations. The beliefs that researchers have about what they expect to find can shape how they conduct the study and interact with participants. These expectations can lead them to unintentionally communicate cues to the participants. Example. If a psychologist is studying a new therapy and is convinced it will work, they might unconsciously behave more positively toward participants who show improvement, reinforcing the idea that the therapy is effective. 2. Non-verbal cues. Researchers may not realize that their body language, facial expressions, or tone of voice can influence participants. These nonverbal cues may lead participants to modify their responses or behaviors. Example. If a researcher raises their eyebrows or smiles when a participant gives a specific answer, it might make the participant feel that their answer is especially good or correct, even if it isn't. Important details. 1. Controlling for experimenter effects. Researchers can take various steps to minimize experimenter effects and ensure the study's results are valid. These may include standardized instructions. Providing all participants with the same set of instructions in the same way can help reduce variability in how the study is conducted. Blind procedures. Using blind or double-blind techniques so that researchers do not know which participants are in each group can help eliminate bias. For example, researchers might analyze data without knowing which participants received the treatment and which received a placebo. Automating procedures. Using computers or automated systems for administering tests can reduce the opportunities for experimenter effects since there would be less direct interaction with participants. 2. Impact on research validity. Experimenter effects can threaten the internal validity of a study, meaning it can compromise the accuracy of conclusions drawn from the data. When experimenter effects are present, it becomes difficult to determine whether the results are due to the treatment or the influence of the researcher. Example: if a psychologist studying anxiety treatment inadvertently praises participants who seem less anxious while ignoring those who don't show improvement, the results may suggest the treatment is more effective than it truly is. 3. Awareness and training. It is crucial for researchers to be aware of experimenter effects and receive training on how to minimize their impact. This can include learning to maintain a neutral demeanor and using consistent procedures during studies. Example of experimenter effects. Imagine a study designed to test a new approach for improving memory. 1. Research setup. Participants are asked to use a new memory technique, while the researchers measure how well they remember information. 2. Possible experimenter effects. If the researcher believes that the memory technique will work really well, they might show excitement or approval when participants demonstrate any improvement. This could lead participants to try harder or alter their responses, thinking they need to please the researcher. Conversely, if the researcher appears uninterested when participants struggle, those participants might feel discouraged and not try their best. 3. Impact. If the researcher's expectations affect how participants behave during the study, it can lead to skewed results. For example, participants might report better memory performance simply because of the encouragement they received rather than the effectiveness of the technique. Conclusion. Experimenter effects are unintended influences that researchers can have on participants, impacting how they behave and respond during study. These effects can lead to biased results and make it difficult to draw accurate conclusions from research. By understanding experimenter effects and implementing strategies to minimize them, researchers can improve the validity of their studies. This understanding is essential as you prepare for your CPC exam and evaluate research findings in your field. Observational research. Sure, let's explore observational research, a fundamental research method used in various fields, including psychology, sociology, and education. We'll break this topic down into key concepts, important details, and examples to make it easy to understand. What is observational research? Observational research is a type of study where researchers observe and record behaviors, events, or situations as they occur in their natural environment, without manipulating or controlling the variables involved. This method allows researchers to gather data based on what they see, rather than relying on surveys, interviews, or experiments. Key concepts. 1. Natural setting. In observational research, observations are often made in real-life or natural settings rather than in a controlled laboratory environment. This helps researchers capture authentic behavior as it happens. Example: a psychologist studying students' social interactions might observe them during a lunch break at school rather than in a structured classroom setting. 2. Types of observational research. There are several different approaches to conducting observational research. Naturalistic observation. Researchers observe behavior in its natural context without interference. For instance, observing animals in the wild to understand their social behaviors. Participant observation. The researcher becomes part of the group being studied to gain deeper insights. For example, a researcher might join a support group to observe interactions from an insider's perspective. Systematic observation. Researchers use specific criteria and guidelines to systematically record behaviors. They might have predefined categories for different types of behaviors they want to observe. 3. Qualitative versus quantitative data. Observational research can yield both qualitative data and quantitative data depending on how the observations are recorded. Qualitative example. Noting the types of interactions that occurred during a group meeting, such as cooperation or conflict. Quantitative example. Counting the number of times a specific behavior, like raising hands in class, occurs during an observation period. Important details. 1. Advantages of observational research. Realism. Since behavior is observed in natural settings, the findings often reflect genuine behaviors and reactions, helping researchers understand how individuals typically act. Exploratory. Observational research can help uncover patterns or behaviors that may not have been previously identified, guiding future research or hypotheses. No manipulation. Researchers don't influence the environment or participants, which can lead to more authentic data. 2. Limitations of observational research. Observer bias. Researchers' perceptions and interpretations may be influenced by their expectations or beliefs, potentially leading to biased results. Limited control. Since researchers do not control the variables, it can be difficult to determine causal relationships. Observational studies can show associations, but not causation. Time-consuming. Observations can take a long time, particularly if researchers are trying to gather extensive data over various situations or time periods. 3. Ethical considerations. Researchers must consider ethical issues, particularly regarding privacy and consent. Observing people without their knowledge can raise ethical concerns, so it's essential to follow guidelines to protect participants' rights. Example: if conducting observational research in public places, researchers should maintain discretion, but if private spaces are involved, explicit consent may be required. Example of observational research. Imagine a researcher studying childhood play behaviors. 1. Research goal. The researcher wants to understand how children interact during group playtime. Setting. The study is conducted in a kindergarten classroom during recess. 3. Observation method. Naturalistic observation. The researcher quietly observes the children playing without interfering. Data collection. They take notes on different types of play and record how often children engage in each type. 4. Results. After collecting data, the researcher finds that children tend to engage more in cooperative play when they have access to certain toys compared to solitary play with books. This finding can be used to inform teachers about facilitating better learning environments. Conclusion. Observational research is a valuable method for gathering data on behavior in natural environments without manipulation. By watching and recording how individuals interact or behave, researchers can gain insights into real-life situations that help inform theories and practices in various fields. Understanding observational research will enhance your ability to evaluate scientific studies, which is crucial as you prepare for your CPC exam. Naturalistic observation. Sure, let's dive into naturalistic observation, specifically in the context of ethology, which is the study of animal behavior. We'll break down the key concepts, important details, and provide examples to help you understand this topic clearly. What is naturalistic observation? Naturalistic observation is a research method used to study behavior in its natural environment without any manipulation or interference from researchers. This method allows researchers to observe how subjects behave in their everyday settings, helping to capture authentic and spontaneous actions. Key concepts. 1. Natural environment. In naturalistic observation, the behavior of subjects is observed in their usual surroundings. This can mean observing animals in the wild, children in a playground, or people in social settings. Example: a researcher studying birds might observe them in a forest to see how they interact with one another in their habitat. 2. Ethology. Ethology is the scientific study of animal behavior, particularly in natural environments. Ethologists aim to understand how animals interact with each other and their surroundings, often focusing on instinctual behaviors. Example: an ethologist might study how wolves hunt, communicate, or raise their young in the wild. 3. Observation without manipulation. Unlike experiments where researchers may control conditions or manipulate variables, naturalistic observation involves observing subjects without trying to influence or change their behavior. This helps ensure that the data collected reflects genuine behavior. Example: watching how children play together in a schoolyard without intervening to change their interactions is an example of naturalistic observation. Important details. 1. Types of data collected. In naturalistic observation, researchers may collect various types of data, including qualitative data, observations that provide descriptive information about behavior. Quantitative data, measurements and counts. 2. Advantages of naturalistic observation. High ecological validity. Because the observation occurs in a natural setting, the findings are often more applicable to real-world situations than results from controlled laboratory studies. Rich, detailed data. Researchers can gather extensive information about behaviors and the context in which they occur. Behavior in context. Researchers can see how behaviors are influenced by the environment and social dynamics. 3. Limitations of naturalistic observation. Observer bias. Researchers might interpret behaviors based on their expectations or beliefs, which can skew results. A researcher's personal views can unintentionally influence how they observe and report findings. Lack of control. Researchers cannot control external factors that might affect behavior, making it difficult to identify causal relationships. This means they cannot confidently say that one thing causes another based on just observation. Time-consuming. Naturalistic observation can take a long time, as researchers may have to spend many hours observing subjects to gather enough data. 4. Ethical considerations. Researchers should ensure that their observations do not invade privacy or cause harm. In many cases, these studies are conducted in public places where participants are not likely to be disturbed. Example of naturalistic observation in ethology. Let's look at how naturalistic observation might work in the study of a specific animal behavior. 1. Research goal. An ethologist wants to study the social behavior of chimpanzees in their natural habitat. 2. Setting. The researcher goes to a national park where chimpanzees live freely in the wild. 3. Observation method. The researcher quietly watches the chimpanzees using binoculars to avoid disturbing them. They take detailed notes on different behaviors, such as how the chimps interact with one another